Hello, I'm Lily. I'm a third year medical student and I'm the student lead for the Endometriosis Awareness Project Student Staff Partnership.
Hi, Millie. My name is Suruchi. I'm a consultant gynecologist. I work in St. George's Hospital and I'm the lead for endometriosis there.
It's lovely to meet you and thank you so much for being with us today and filming these videos for the project to hopefully raise awareness about endometriosis in St. George's community. So would you mind starting off by telling me a little bit about your job treating endometriosis patients?
Sure. So I work in St. George's University Hospital and I'm the lead for endometriosis there. I have been working here for the last 8 years and my job has mostly involved just being doing gynecology and working with women with endometriosis. So I do like 2 or 3 endometriosis clinics every week and I operate on women who have endometriosis.
Oh, thank you. And what made you want to go into treating women with endometriosis?
Well, there are lots of reasons. So the main thing is that endometriosis is a very common gynecological condition. It is the second most common gynecological condition. Yet it is underfunded and there is not much resources into endometriosis. So that was one thing, I felt that women with endometriosis need to be heard. Secondly, there's a lot of research and there's lots of new things coming out in endometriosis. So when you're working in endometriosis, you're always learning, whether it's scanning, whether it's medication, whether it's surgery. There's so much happening that, every time you have to be up to date with the recent literature. It's very interesting, the pathophysiology of endometriosis, the biochemistry of endometriosis. It's all very fascinating. And we still don't know what causes endometriosis. So as a subject, it is a very fascinating subject and very engaging subject to study. Thirdly, if you work with women with endometriosis and you listen to them and you treat them, you can change their lives in a very significant way. So when I do my clinics, I think that's the most satisfying day because sometimes women come and they invariably cry in the clinic and they said, thank you for just listening to me, because they say that they've been gone through this process where they were ignored, where they were told that, periods are supposed to be painful and it's just a part of being a woman. Some were told you're just, a whinger. And sometimes they just say, just thank you for saying that I have a problem because I was thinking that maybe I'm going mad. I'm imagining this pain because people won't acknowledge it. So I think it's a very rewarding specialty to be in. And you can help women with endometriosis. And the last reason is a very personal reason, which is that my grandmother had endometriosis, so she suffered from pain, subfertility. She needed a hysterectomy. And then my sister and myself, we both have endometriosis, so we have experienced firsthand what the symptoms can be, how it feels, how isolating it can be sometimes, and how women need to be heard and treated in the right way by the right people.
And so when you see women in your clinic, how would you say they typically present to you? How do you see them?
So the story for each woman is different, but there are many similarities to it. The cycle starts very early on in a woman's life when they have their periods, and the periods are extremely painful sometimes. And you can see that girls in the school are missing school, especially during the periods. We call it cyclical absenteeism. And if I may just elaborate, they're not listened at from that point on, because first they're told the periods are supposed to be painful. Then they are told that, is there something wrong? Does she not like going to school? Is that why she's missing school? So this process of pain and people not acknowledging the pain starts quite early on. Usually what with children or adolescent girls would say that we keep the warm water bottle and, go to the loo and sit in the toilet for a little while, and that helps. And sometimes they're taking a lot of painkillers, especially during their periods, just to get on top. And there's always this anxiety also starts because, you worry which day my period is going to come. Is it going to be on the day when I have my exams? How is it going to affect my outcome in the exams, my performance? So that is how things go early on in life. And then you sort of become more used to dealing with these symptoms. You want to look forward to, women want to look forward to establishing their careers, having a life, and again, the same things, this sort of pulls you down. And what pulls you down most is when people don't acknowledge your discomfort. Then you come to the childbearing age, and I think what hurts most is when you try to conceive and you can't conceive, and you see everybody around you having children and, being very happy. And then again, the same thing that, this hurts the most because this is totally not out of your control. You can grind your teeth and you can bear the pain. But when you just really want to have children and you can't have children, and that bit can be very frustrating. Again, in society where some people are very healthy and fit, that sympathy or empathy for women with endometriosis is missing. And then, sometimes women do get pregnant, and even that is very anxious because sometimes they can have ectopic pregnancies, miscarriages, preterm delivery. Even after delivery, there's a small risk of bleeding if there's associated adenomyosis or fibroids. And this process of anxiety that amplifies the pain. And, women with endometriosis, they're very strong. They carry on. But as you come to the mid-30s, mid-40s, the pain, bleeding can get much worse. And they go on the pill. And each pill, like progestrogens are the most effective after 35. But progestrogens have their side effects. They can lower the mood. They can cause acne. And, sometimes women say, I really don't want these medications. And it's a chronic condition. Surgery helps with the pain, but the disease can come back. So it is a very complex disease which can present in a lot of ways. And it also depends on where the disease is. Sometimes it is just in the pelvic area. Sometimes it is elsewhere in the body where it's much more complex, involving the bladder, the bowel, even the lungs, the umbilicus. So it can present in just so many ways. And then finally women think that I have approached menopause. It's over for me. Now the estrogen is gone, so I will live in peace. But then you get menopause and you want to go on HRT. And the moment you go on estrogen only, you can't go on estrogen only because that's going to exacerbate your symptoms. And I have got a lot of women who come to me in the menopausal age group and they're like, my bleeding and pain has come back again. So it is something that is a chronic condition, just like diabetes, asthma, and it stays with you all your life, and it needs to be managed all your life, but not that it can't be managed. I have seen many women have very fulfilling lives, children, good careers, everything. But what it needs is people who understand the disease and who can treat it well.
Mm-hmm. And do you think as a society on the whole, we aren't very good at dealing with women who have endometriosis and supporting them?
Well, I do think so, unfortunately. I think as a society, we are not very good in managing chronic conditions. And we're doing a bit of work. I'm looking into things, acute admissions in women who have chronic problems. So these chronic problems are ignored, like heavy menstrual bleeding, fibroids, endometriosis. And they finally present in the acute setting. And these women come and, take up a lot of time in the acute setting because these chronic problems, when they could have been managed, they are not being managed at an early stage. First, they need to be acknowledged, they need to be diagnosed quickly, and then they need to be managed holistically. It is not just, one size fits all. Every woman with endometriosis is different. They have different needs, but all of them need that acknowledgement and that kind of extra support and help to fulfill their life.
And you've touched a little bit on the psychological impact that endometriosis can have on women. Would you mind talking a little bit more about that, please?
It's a huge psychological impact. At every stage, there is an anxiety associated with the disease. And there's been a lot of research done that anxiety, what it does, it amplifies pain pathways. When you're feeling anxious, when you're feeling unsupported, when you're feeling unheard, you feel pain more. And then that vicious cycle starts and pain becomes chronic pain. So something very simple is just listening to these women and say, I'm sorry you're in pain. There are few things we can do for you. And, preventative things like, it's not like, exercise is going to change the course of endometriosis, but the endorphins, they reduce the perception of pain. diet is not going to change endometriosis, but if you're taking an anti-inflammatory diet where it is, not taking too much red meat, alcohol, or inflammatory things, it can reduce the sort of things that increase the perception of pain in the body. So there's lots of things like, pelvic exercises, yoga, meditation, and of all of this in combination with surgery and medication will help women live their life to their potential.
And what sort of symptoms would you say that people should look out for and approach their GP if you're experiencing them?
So the symptoms can be very complex. It can be endometriosis, which is in the pelvis, as I said, or it's outside the pelvis. So sometimes I find women who have bad endometriosis, but they don't feel pain. And there's sometimes women who feel a lot of pain and all they have is just maybe a spot of endometriosis. So it's a very, very complex condition. Most commonly, it would present with what we call dysmenorrhea, which is painful periods, dyspareunia, which is painful sex, dyschezia, that is pain during opening the bowels, especially when somebody is on a period. And if it is associated with a condition called adenomyosis, which is when the lining of the womb is in the muscle layer of the uterus, then there is heavy menstrual bleeding as well. But the presentation can be different. Sometimes, it can just present with women who are having difficulty conceiving. So 50% of the women who have difficulty conceiving, they can have endometriosis. So it's very difficult to say what exactly the woman is going to present with. I have seen patients who have got endometriosis in the diaphragm, endometriosis in the lungs, and endometriosis in the umbilicus. They bleed from the umbilicus when they're having their periods. Endometriosis in the bladder, which can present with blood in the urine, endometriosis in the bowel that can present with PR bleeding when you're on a period. So it's a very complex disease. It's like, you can't say this is exactly what would, but mostly the symptom is some kind of a pain or discomfort, which is cyclical in nature.
And what sort of treatments are available for women who may be experiencing symptoms of endometriosis?
Sure. So presently there are two main treatments. One is hormonal treatment and the other is surgical treatment. But most women would need a combination of both treatments because research has shown that it is a chronic condition. So if you just treat somebody with surgery and feel that it will treat everything, know that the disease comes back, there's a recurrence rate for the disease. So what we need to focus at is how can we predict who is going to develop the disease and stop the progression at a very early stage before it becomes bad and it causes issues.
Are you involved in any research happening to do with endometriosis?
I'm involved with quite a bit of research. I would ideally want to do more, but unfortunately I don't have time. But what really catches my fancy is the pathophysiology of the disease and the genetics of the disease. I think that is where the future is. If we can identify those group of women who have more propensity to develop endometriosis, then we can target the treatments at an early stage to these women. So we look at the various genes associated with endometriosis, whether there is anything we can do to identify them. But unfortunately, there's a huge pool and it also depends in different sections of society. So the pool is not the same for all women. Caucasian women will have different set of genes and somebody Afro-Caribbean or, so it's also complex. But my personal feeling is that there is definitely scope here. And that is where most of the research in the future is going to be focused. Also to stop the inflammation. So what it does, the main problem of scarring and pain is due to inflammation. So if we can prevent neurogenesis, which is new nerve formation, if we can prevent inflammation from causing fibrosis, then all of that will help. So maybe targeting those genes and also studying the associations of this condition with other conditions like fibroids, endometriosis, polycystic ovaries. I think it's very important because my feeling is it's all linked together. So I think there's a huge potential. There's a lot of research going on into new medicines, new kinds of surgery. But I think the focus has to be to stop the disease at a very early stage before it impacts the lives of women so significantly.
Is there anything that you would like all healthcare professionals to know about if they see a patient with endometriosis, what they should know about the disease and how they should treat this woman?
I think the key is diagnosis. What research has shown that even now, women are having to wait 7 to 8 years before being diagnosed with the condition. And the awareness for that is going up amongst the GPs, and now we are getting more awareness of it. But with awareness, there should be a commitment from the government, a commitment from healthcare setups that, look, this is the second most common gynecological condition. What can we do to improve resources in this specialty? We need more doctors with specialist interest in endometriosis. We need nurses, because doctors can't give as much time as these women require. We need specialist nurses who can talk to women, give them a little bit more time. We need psychological support for these women. We need pelvic physiotherapy for these women. We need specialist surgeons who can deal with complex diseases involving the bladder and the bowel. We need specialist fertility service, something like egg freezing for women with endometriosis. It's still not available in the NHS. And, not everybody can afford private egg freezing. But, if women had the choice, some of them may want to have that. So there's lots of things that can be done. But unfortunately, we are at a place where the finances are very restrained. So I think just raising awareness and openly acknowledging the condition and saying that, whatever your situation is now, there is lots of things available, and you can still live a very fulfilling life with the condition, so that women don't feel so anxious all the time.
Are there any patient cases of women who treated endometriosis that stick out in your mind that you wouldn't want to share?
Lots of them. All my patients are, that is the most rewarding thing. You're a part of their life, part of their journey. I've had patients who have got, I think of a patient who actually is a medical professional, and she was suffering from the age of 12, and she kept going to the doctors, and she also had big fibroids and huge big endometriotic cysts. And at one point she was told, "You're just fat, go to the gym and try to lose weight." And then she had an ultrasound which showed like huge big endometriotic cysts and fibroid uterus. So you hear these stories, and I have got patients who have spent their life, just carrying on with their life because they think, okay, this is supposed to be painful, this is supposed to be painful. And then they have problem increases, and then they have a scan, and they're like, oh, it's quite severe disease. And then it really hits them, because they said, we were always told it's supposed to be painful. So we never knew that it should be any different. When it's your period, you don't know what is a normal period, what is not a normal period. You can't compare the pain. And so I think the overall, story is different, but I get so much inspiration from my patients, because they still come, they smile, they cry, sometimes cry in the clinic, but they're smiling, they live their lives, and they do their best. And, I feel inspired by them. It can sometimes be frustrating. Sometimes patients come and they say, my pain is gone. Mm-hmm. You have changed my life. I didn't know how it was to feel that, you won't be in pain. But sometimes they come and the pain is still there. Mm-hmm. So that is the challenge in endometriosis. Not everybody reacts in the same way to the same treatment. Mm-hmm. And, that is why understanding the disease, as in where exactly it is it associated with adenomyosis? Because that's a common reason why, in a reproductive age group woman, you won't remove the uterus, because uterus is required for fertility. But if there is associated adenomyosis, the pain persists, and, having an operation is a big deal. Yeah, but I wish I could help everybody. But, I still, the happiest things, that I hear, you have changed my life. That feels really good.
So, how can we raise awareness about endometriosis?
So the awareness need to be raised at various levels. I would say some awareness needs to be raised at the level of schools. Then having the website like you are creating for this project, it's invaluable, because people can go to it. And, what I was thinking is, in this condition where the NHS has such limited resources, we won't be able to provide pelvic physiotherapy, nutritional advice, general information to each and every individual separately. So if you have a website where you can click and say, oh, this is the information about nutrition, this is the information about exercise, this is the information about fertility, and it is in a way that people can understand, that's very useful. Having a link which has got all important research work on endometriosis, having a link which has got all important clinical papers on endometriosis, that is quite invaluable. I think having a link for GPs, what can you do as a level of at the level of primary care, having a link for general gynecologists, how do you understand this disease better, what are the imaging modalities, what are the subtle features of adenomyosis, because things like this get missed until you have a deep dive into endometriosis. So I think there are solutions. We have to look at solutions. We can't just say that no money, we can't do anything. So and solution is empowering women with information, with knowledge, and with resources.
What advice would you give to students going into healthcare professions to further educate themselves about endometriosis and other gynecological diseases?
I always say the same thing. It's one of the best specialties to go into. I love it. The reason being that you can change, you can understand patients and you can change their lives in a very significant way. And no amount of money will give you that much satisfaction in life as the satisfaction that you have helped and improved the quality of life of someone. So I think it's hugely rewarding. And the thing is, in gynecology, in women's health, as I said, you're dealing with women who are young and who have the whole life in front of them. And if you can just advise them, sometimes women come and I tell them that, look, don't worry. Most of the people I come across will have children. You will have a fulfilling life. And they cry and they say, just thank you for saying that, because I was so worried. So I think knowledge is power, and listening to the patient is power, empathizing with the patient is power, and having the right vision that you want to make a difference. I think it can be so satisfying.
How do you think the government could help advocate for patients with endometriosis and ensure that they receive healthcare that helps them with their needs?
So I think a government can do a lot. I think all the healthcare targets at the moment are focused on cancer waiting times, cancer treatment, and cancer is very important, needs to be dealt with well. But at the same time, as I said, endometriosis affects women at a time of their life when they are entering the journey of life. And that is why it is very important that we sort of give them the right support so that they can fulfill their lives. So acknowledging that, we can't have waiting times for endometriosis and clinics which are 6 months. Women are waiting for surgery for a year. That is simply not acceptable, These women, by the time they come and see you, the average waiting time is 7 to 8 years. Then they are waiting for surgery. Then they are waiting for a follow-up. So I think we need more sort of resources into endometriosis so that we can reduce these delays at every level. And there has to be some kind of acknowledgement that yes, this is a very important condition. We can do things at workplaces to enable these women that, don't worry, if you have endometriosis and, if you feel that if you may have to miss a day or two of work, that is not going to impact your career. We understand, that you have a lot to offer. So I think enabling workplaces to offer this kind of support to women, to students in universities, I think that understanding has to come. And from the government, there have to be policies saying, look, it's not all about malignant diseases. We need to address chronic conditions as well, because chronic conditions take a huge toll in the life of people. And these people who have chronic conditions actually have a lot to offer.
And from your experience, would you say that healthcare inequalities play quite a large part of the fact that endometriosis, there isn't a lot of awareness about it and patients have to wait quite a long time?
So yes, I mean, we work in St. George's Hospital in Tooting, and we have not the most affluent amount of people coming to the hospital, and I really feel for them because they suffer in silence for such a long time, and then they don't have the resources to fund private healthcare. And, when they come and the endometriosis has reached a stage where it is so bad that, it is difficult for them to have children, and, this psychologically they are so disturbed, mentally they are so disturbed, and, just feel like you need to do something at an early stage for these women, they shouldn't be at this stage. So that is why I feel the focus has to be, early recognition, early diagnosis, and preventative things, understanding the pathophysiology of disease, understanding the genetics of disease, and, focusing on the holistic care of these women so that we diagnose and treat it at a stage where they can still live their life.
And do you think there's a reason why maybe in the past and perhaps even currently women's pain hasn't been taken as seriously as it maybe should have been?
I mean, my views may be a bit biased. I think the society is still driven by men. And unless you feel the pain yourself, you cannot empathize with it. Things are changing. And, I've got colleagues who are men who are very empathetic. So, I'm not anything against men. But I think, people need to understand this. And I think we need stronger voices from women to change things.
And from what you've been saying, it sounds like hope is quite a key thing when treating patients with endometriosis.
Of course. I think just sometimes I just, listen to the patients and they cry and they say, I just feel so good that somebody finally understands. So I said, this is something that doesn't need a healthcare professional, for people at home, for schools, for universities.